Good evening to many of you. Good afternoon to some. And I'm just going to turn on my video so that you can see me while I welcome you to the webinar. Thanks so much to everyone for joining us from literally all around the world. I am Diana Mackay with the Institute for Global Health and Development at Aga Khan University. My role is to help us get started with a few comments to set the stage for today's webinar. First, a reminder that the session is being recorded, and we will make the recording available on our Institute's website within a day or two. The Institute's website is aku.edu/IGHD, with IGHD standing for Institute for Global Health and Development. We have over 600 registrations for this webinar, and with that many people involved, we can do some exciting things to help people learn together and connect in useful ways. So about the Zoom features that we have enabled today. Please first use the chat function. It's a terrific tool if we use it well. You can, if you wish, introduce yourself by name and organization and also location around the world, particularly if you have an interest in networking with others who are participating today. It's a great way to say hello and to express your interests. But given the large audience, I would also ask that you keep your chats short and to the point. You can also use the question and answer function to pose questions that our moderator and speakers might want to address in the discussion to follow the opening presentations and remarks. We'll do our best to address them during the webinar or by follow-up afterwards. Keep in mind, one of our objectives of the session today is to build communities or networks of individuals who would like to explore working together. So let us know if that's the case for you. Finally, you're always welcome to communicate with us by email, and the Institute's email address is ighd@aku.edu. We'll put that address in the chat for you. Today's webinar is accredited by the Accreditation Council for Continuing Medical Education, and an e-certificate will be provided after the session. On another note, you may be interested that another webinar is being planned for the second week of December on topics related to gender equity. While today's session focuses on global health, the Gender Equity Committee at Aga Khan University is organizing a session on gender equity and leadership in higher education, with the discussion focusing on challenges posed by COVID and women leaders in higher education. So stay tuned for word about that. You'll be also hearing more during this webinar about a new Women in Leadership program, a joint initiative of the Aga Khan Foundation and the Gender Equity Committee at AKU. This program will be announcing its first application call in January. It's a 6-month-long course that aims to equip mid to senior level women in areas of organizational dynamics, strategic planning, personal leadership, and more. You'll be hearing more about this later in the webinar. Finally, and back to today's discussion, I will note that all of you should have received a brief overview of the webinar in advance, which included the bios of our speakers. So in the interest of time, we'll be keeping intros brief. In that spirit, I would like to get us started with just a few words to introduce Dr. Zofie Bhutta, who is very well known to so many of you. Dr. Bhutta is the founding director of the Aga Khan University Institutes for Global Health and Development, and he is the co-director of the Sick Kids Center for Global Child Health. He has dedicated his career to the promotion of the health and well-being of women and children, and the intersectoral approach to these issues that we are taking at the Institute is a hallmark of Dr. Bhutta's research work. Dr. Bhutta, over to you.
Thank you very much, Diana, and welcome, ladies and gentlemen, from across the world. I'm absolutely thrilled. We are close to 170 participants already. I know that there will be a lot more joining, and the participants list is a who's who of people in various aspects of global health. Welcome to you all. I'm particularly thrilled that we have many leaders from the Aga Khan University, from the departments, several deans who have joined. And I am absolutely delighted that so many young women have joined from both within Pakistan and the region. This is a webinar principally for you, for a discussion on what can we do better in terms of promoting gender equality. And we have a stellar panel of speakers that I will be introducing as we go along. But first, a word about the Institute. The Institute, as Diana said, it builds on the Aga Khan University's vision of building on its existing strengths in health sciences, in catalyzing collaborations across the campuses and entities of the university, and its reach within the broader remit of the Aga Khan Development Network. So the Institute spans not only Pakistan, Central Asia, also East Africa, and has strong links to our Institute of Studies of Muslim Civilizations in the United Kingdom. Core objective of the Institute is to promote cross-disciplinary work, and of the various pillars that we have already had webinars on climate change and health, on the role of the environment, on the role of agriculture, food security, and today's webinar on the topic of gender equality is very close to my heart because this is a pillar of the Institute for Global Health and Development, particularly in terms of what we can do to strengthen the growth of women in science in relation to global health. We are very pleased that one of the senior members of our International Advisory Committee that guides a lot of the work of the Institute for Global Health, Dr. Agnes Venengaho, who will be welcoming you all. She couldn't be with us in person because she had a parallel commitment, but she'll be speaking virtually. Dr. Venengaho is a world-renowned pediatrician, a former Secretary of Health in the government of Rwanda, and a Minister of Health, and served in various leadership capacities for almost 14 years. On the international scene, she has been a member of several high-level Lancet commissions on women and health, and more recently on the Poverty Commission, the NCDs, Non-Communicable Diseases and Poverty. She is currently the Vice Chancellor of the Partners in Health Initiative on University of Global Health Equity in Rwanda. And I'm very pleased that she's going to be able to welcome you all. So I'd like to pass the floor to Dr. Venengaho.
Dear Zofie and all participants, hello, wherever you are in the world. On behalf of the International Advisory Committee of the Institute of Global Health and Development, I do like to welcome all participants to today's sessions and discussions. From the onset, our committee is glad that gender equity is a focus of the Institute's work to promote a healthy life for all. Today's speakers have been selected not only because they are experts in gender and health, but also because they are women, leaders in science. Our goals for the gender equity in health require more women leaders in the organizations that drive results. At my university, the University of Global Health Equity, we have taken this responsibility at heart, from requiring 50% of all students in all schools, institutions, and centers to be female, and 70% of the medical students to be female. This we have also promoted by establishing a Center of Gender Equity and running an annual gender and diversity audit. The university, UGG, has streamlined gender equity into all aspects of our work. This is why I am highly delighted and I appreciate this webinar series initiated by the Institute. While today's session is online, I urge you all to forge a lasting connection with the Institute. It is through such initiatives that tackle global challenges across disciplines and organizations that you can truly make a difference in complex issues such as gender, equity, and health. This is especially true when the three are tackled together. Thank you for having me joining you, and I wish you all a productive discussion.
Thank you very much, Agnes in absentia, and we are very pleased that you were able to send us your introductory and note and best wishes. Now for the real fun part. And I'm absolutely delighted that we have amongst us today probably two of the global leaders in this particular field, and I will introduce them in sequence and they'll present after that. Anita Zaidi, to many people in the audience, needs no introduction. She's one of our most distinguished alumni from the Aga Khan University, where she graduated from the first class in 1988 at the top of her class. She then went to the United States for further training in pediatric infectious diseases in Boston, at Duke's, and also obtained her master's in public health. She was the chair in the Department of Pediatrics at Aga Khan University following her return to Pakistan. And then in 2014, transited to head the Diarrheal Disease and Enterics program as the director at the Bill and Melinda Gates Foundation. But she's continued her active involvement in Pakistan. In the year 2014, she won the coveted Kaplow Prize in a global competition for her project on alleviating health problems in one of the poverty-stricken fishing communities in Karachi. She's now the president of of global gender equality at the Bill and Melinda Gates Foundation, and very aptly will speak to us today on Can Gender Equality Save the World? Following Dr. Zaidi, we have the very distinguished Dr. Sania Nishtar joining us from Islamabad. Sania is not only a fellow graduate from the Khyber Medical College, but I have followed and known her for several decades. She is currently the Special Assistant to Pakistan's Prime Minister and the Federal Minister in Poverty Alleviation and Social Safety. She's the founder of ESAS, the government's flagship program on social protection, and leads its implementation. She also chairs the Benazir Income Support Program and the Government of Pakistan's Council on Poverty Alleviation. On the international front, Sania has led many initiatives, has been on the forefront of many organizations, such as the High-Level Commission on Non-Communicable Diseases at the World Health Organization. She's been the chair of the World Economic Forum's Global Agenda Council, and she also chaired a very important National Academy of Sciences United States study on quality of healthcare in low and middle income countries. I could go on, but amongst Sania's distinguished landmark achievements is she was one of the finalists for the Director General position at the World Health Organization, and just a couple of days ago has been placed amongst the BBC's World's Most Influential Women category. So Sania, congratulations, and we'll be hearing you after Dr. Anita presents on your work on the ESAS Emergency Cash Program in terms of its real-life evaluation. So without further ado, I'd like to pass the floor to our speakers. So Anita, the floor is yours, and tell us, how can gender equality save the world?
Thank you, Dr. Bhutta, and Assalamu alaikum. Good morning, good afternoon, good evening to our audience over here, wherever you are joining from in the world. I can see in the chat function that it really is a global audience here. If I could just request my slides to be put up, that would be great. Or yep, here we go. So thank you very much for the invitation and for hosting these series to the Aga Khan University and to the Institute for Global Health and Development at the Aga Khan University. The reason that I, next slide please, chose this topic, basically I had two thoughts. I had two big thoughts in mind. One is that we are, and I do not think I will get any argument on this, we are living through just extremely challenging times right now in the world with the pandemic, and then many other, even before the pandemic, many other existential crises which will affect or are affecting our livelihoods and our well-being around the world. And these include extreme and growing income inequality, climate change, pollution of the oceans, mass extinction of species due to our activities, and antimicrobial resistance. And these are all truly challenges that require a lot of global health and collaboration to solve, and they touch all aspects of life. So the question that I'm posing is, can we imagine a better, more equal, more collaborative world where women and girls also have the opportunity to thrive and reach their potential, including finding solutions to the problems that we find ourselves in. And so that is reason one why this topic is so timely, because it has to be absolutely embedded in whatever the world is that we build back after the pandemic. And the second reason that I have been thinking about this topic is that we have just at the Bill and Melinda Gates Foundation launched the Gender Equality Division, which presents for women the opportunity for advancing progress for women and girls in accordance with the Sustainable Development Goal 5, which, as I'm sure many of you know, is achieve gender equality and empower all women and girls. Next slide, please. So as I think about what that means and what it is that the new division should do, many questions come to mind. I mean, should we focus on health for women and girls, health for adolescents? An unbelievable 1.8 billion people right now are between the ages of 10 to 24. And we do not think of them from the public health point of view. And this is the future of the world. These are the people who are online, who are on the internet, who are our future generation, and yet we do not have public health programming for them. Or should I think about women's economic empowerment, livelihoods, having women, promoting women in the formal workforce, increasing opportunities for decent work? Or should we focus on the lack of opportunity that women have for career advancement in global health and in many other regions, many other areas where which intersect and touch upon all of the areas that I presented to you as sort of the big global challenges of our time. Or should we focus on norm changes, thinking about how do you touch and reach people so that they value women and work together with us to provide opportunities for us. So it's a huge canvas. I've been saying that it's actually harder than poverty reduction, because most people will agree with you that poverty is bad and we should work hard to reduce it. But many people will not agree with you that gender equality is a problem and that we should do something about it. I'm going to try and change your minds about that today. The slide that I have up over here is basically a good way to think about it. It's the philosophy for our work at the Bill and Melinda Gates Foundation. It's at the core of it is our belief that all lives have equal value, and that our primary job and work has to be about reducing inequities around the world, so that we can live in a world where every person has the opportunity to live a healthy and productive life. Where we have focused to date are on areas of greatest need, taking risks, financial risks, or other kinds of risks that others cannot or won't take, and then making markets work for the poor. And this is included ensuring more children and young people survive and thrive, empowering the poorest, especially women and girls, to transform their lives, combat infectious diseases that particularly affect the poorest, and there's many infectious diseases that we focus on, and then inspire people to take action to change the world. So you can see that if one of our core missions is empower the poorest, especially women and girls, to transform their lives, it makes sense for the foundation to have a division that focuses on gender equality and embeds gender equality in all of the other work that we do. And so this is the tough task that is in front of us, and also a very exciting time to be thinking about these issues. Next, please. So in this slide, what is depicted is the current, how much COVID has affected countries around the world. And you could see where the map is maroon, almost black, perhaps, is where the countries that are the most affected with the most numbers of deaths. And there are many countries that have had more than 100,000 deaths. US has had the most deaths, almost 260,000 deaths already. UK, Brazil, these have been the extremely affected countries. The question I have in the title is, what do Germany, Denmark, Norway, Taiwan, and New Zealand have in common? And what they have in common is that they have done a fantastic job of controlling this disease. They are different sized countries all around the world that have very few deaths compared to their neighbors and compared to the rest of the world. And all of these countries have one thing in common: they have women leaders. And this has gotten a lot of media attention. Next, please. One click. And people are now beginning to study it as an academic subject. And this paper here by Garikipati and Kambhampati basically says that their findings show that COVID outcomes are systematically better in countries led by women, and to some extent, this may be explained by proactive and coordinated policy responses adopted by them. And this includes, really caring about people's well-being, about their people's lives and livelihoods, and communicating very effectively with the population so that they can follow the very complicated non-pharmaceutical interventions world that we are in until we have vaccines rolled out. So to answer the question, does gender matter in the COVID response? It appears to be mattering a lot in terms of leadership. Even in India, the places that have done well, like in the south, have had women leadership, and this has been written about as well. Next, please. This map shows the SDG index as measured in 2019 by country, and as I said, SDG 5 is the gender equality goal. And all of these types of maps that start to look at, the progress on gender equality around the world, unfortunately, Pakistan is amongst the sort of bottom of the countries, because the index measures educational attainment by girls and women, health attainment, economic and political participation. And when you add them all up, Pakistan lags behind globally as well as in South Asia. And I chose, I know many of you look at our health indicators. For example, neonatal mortality is one where Pakistan has the highest neonatal mortality in the world, and that has to do with not having adequate access to skilled birth facilities for women. Which affects our child mortality rate, neonatal mortality rate in turn. Next slide. But I chose a different index because we talk so much about the modern economy being a digital economy. And we talk so much in global health also about finding digital solutions to some of our toughest problems. And there has been a lot of progress in mobile phone ownership by women. 80% of women around the world now own a mobile phone, which represents an increase of 250 million since 2014. This is a work by GMA. And 48% of women around the world now use mobile internet, which is the primary way that women access internet around the world, which that all people access internet around the world. Most of it is through their mobile phones. Now there is globally a 10% gap between male ownership of a mobile phone and female ownership of a mobile phone. So around 200 million women less than men own a mobile phone. And 313 fewer women use mobile internet. Where this is the most gender disparate is in South Asia, where 28% less likely, women are 28% less likely than men to own a mobile, and 57% less likely to use mobile internet. Next slide. When you look at Pakistan in particular, Pakistan is probably right at the bottom of the sort of gender disparity in mobile phone use, where you see the last figures I could find were for 2016. It's 77% men and 30% women own a mobile phone. And if you look at the really poor, it's 71% and 19%. And if you look at rural, it's 75% and 22%. So that, which is shocking in its sort of ability to starkly point out how much the experience of women is different from the experience of men, and how much empowerment women have even to be able to own a mobile phone. Next. Okay, so what I thought I would do is focus on a few women today, 3 women, but also including Stacey Abrams in it, which is sort of, that would be 4th, that are making so much, such a big dent in the world today that they're worth talking about, and women that are inspiring me every day to keep going and keep working towards gender equality, and also to get rid of the pandemic, the COVID-19 pandemic. This is a quote that is actually from Archimedes. It's give me a place to stand and I will move the world. But it's been taken on by grassroots organizers around the world, especially women organizers, and was recently Stacey Abrams said this in an interview, and she is a politician from the US, from Georgia, who is a grassroots organizer and is credited with registering 800,000 new voters in the state of Georgia, which for the first time became democratic this year, and was won by the incoming president of the US, President-elect Biden. And she is also right now the person that is most active in trying to get the 2 Senate elections that are still undecided to go blue, which has a pretty significant impact on what the new administration will be able to do in the US as well as around the world for COVID response. So it's something that people are following very actively, and where Stacey Abrams is just putting sort of blood, sweat, and tears, I guess is what we can call it, in trying to make sure that these people get elected. Next slide. So my first sort of woman that I am highlighting here is Catelyn Kariko, who is a Hungarian biochemist and a senior vice president at Bion, overseeing their mRNA work. And why do I choose her? She is an incredible scientist who, against all the odds, kept pursuing mRNA as a possible way for delivering proteins to the body to fight cancer and to fight infectious disease. In fact, so much so that when her work was failing in the lab, she was actually demoted at the University of Pennsylvania, and she still kept going. And that is the work that has come in so useful today. And the company BioNTech hired her to oversee their program. And this is the Pfizer BioNTech vaccine, which is shown to be 95% effective, is basically riding on her work. And what she figured out, so she's going to get the Nobel Prize for this for sure. What she figured out was, how does one, so one of the big problems with mRNA is instability. So how does one actually deliver it to the body? And she figured out chemically how you could stabilize mRNA so that it could actually get inside cells and start getting translated into proteins. And she kept doing it despite all of the odds. And so, this report is worth reading in the Boston Globe, where a once dismissed idea became a leading technology in the COVID vaccine race. And this is not just important for the COVID vaccines, because this is completely new technology. It will be important for a lot of cancers, and it will be important for a lot of other infectious disease, and for future epidemics and pandemics, where you can very quickly make a vaccine for new bugs, or for bugs for which we do not currently have a vaccine. Next. So be on the lookout for Catelyn Kariko Nobel Prize. The second person I chose is Malala, and of course Malala is our very own Pakistani woman, and at the moment Malala is and continues to remain the biggest voice around the world, the most important voice in advocating for girls' education around the world. And one of the big issues in that people are fearing and are observing is that more girls than boys are dropping out of school, given the economic hardship that people are facing. And these girls are going to be lost forever, that they will be getting into early child marriages and will never come back to education. And Malala's voice is going to continue to remain, and she is using it, very relevant to pushing for global education and education for girls to get even more funding than it has to date. And she has a inspiring statement, which I don't know if you can see, it's cut off from my screen. I believe we will see every girl in school during my lifetime. And let's wish her all the best in achieving this vision. Next. The third person I'm choosing to highlight is a woman called Mariana Mazzuccato. Mariana is a professor of economics at University College London, and she directs an institute called Innovation and Public Purpose, the Institute for Innovation and Public Purpose. She has authored many books, but the one that I really admire is The Value of Everything: Making and Taking in the Global Economy. Mariana is, and you see two quotes from her. One is actually quite recent, which is, "Today's capitalism is incompatible with feminism." So it is incompatible with gender equality. And her voice is right now one of the loudest in envisioning a post-pandemic world that redefines what is valued. So one of the things that the pandemic has made clear is how much of capitalism is riding on the undervalued labor of women. And if you look at essential work, who are essential workers now, they're not the people that we used to think were essential workers. They are the people who are cooking, working in the West, working in grocery stores, delivering care around the world, including healthcare. 70% of the global health force is women. Mariana says, what is needed is both a new deal in terms of mission-oriented investments, but also a new deal in terms of a modern social compact, one that allows the state to socialize not only risks, but also rewards. Because right now what we have is that the state funds a lot of innovation, but private sector takes the rewards. And maybe then we will have innovation-led growth, which will become growth that includes all of us. WHO recently set up a new council called the Council on the Economics of Health for All in the post-pandemic world. And Mariana Mazzuccato was asked to chair that council. So we look forward to her contributions to how to redesign the world post-COVID so that everybody has an equal chance to come up. Next. So I wanted to say a little bit about some of the initiatives that are going on in Pakistan that from the Gates Foundation in economic empowerment and in women's leadership, which are two areas that I'm very keen on being a part of or a big part of our global gender equality division. Next, please. So one is our partnership with Karandas and UK Aid, which funds financial inclusion for women. And they just funded another round, which is called Women Challenge Round, Financial Inclusion of Women Challenge Round. And three innovative ideas were funded here. One is to NRSP, which contributes to financial inclusion of women by enlisting selected female beneficiaries as field banking agents and equips them with technology to process loan applications on their phones in the field instead of back-end offices. So women can, if they want to start a small business, they will be able to access funding. Second is a private organization called Udan, which is basically has developed an app, which is our committee system that is a traditional system for Pakistan women to save money. This is an app that will promote linkages between women savers around the country. I mean, they may not need to be physically located in the same place. ROSCA stands for Rotating Savings and Credit Associations. So it is the formal way that is recognized now of the maybe formalizing the informal committees that women have to be more effective and connected up. And then Techlits is another platform that connects women influencers with suppliers and connecting them to markets so that they can get better payments for their products. So these are three very early ones. This was just rolled out a couple of weeks ago. Next. Another example is working with the State Bank and with Seema Kamil, who is the Deputy Governor of State Bank, very interested in gender equality, and she has a new program called Banking on Equality, a policy to reduce the gender gap in financial inclusion. So you can imagine, I'm not showing you the data here in the interest of time, but you can imagine if even mobile phones are ownership is so discrepant, how much the sort of banking accounts will be discrepant between men and women in Pakistan. Next. And then this is a program that I'm really proud of. This started without the foundation. And this was launched by Shabnam Sarfraz, who's in the Planning Commission. It's Women in Global Health, which is a global program started by Rupa Dutt, and which is then formalizing chapters, organizing chapters for women in global health all around the world. And Pakistan is one of the most active chapters. And in fact, the first Women in Global Health chapter in Asia. They had a really good meeting last year. Dr. Sania Nishtar, who you will hear from afterwards, is the patron. And we are now funding funding several chapters around the world, including trying to provide support for this so that they can enlarge their membership. And in the slides, which I hope can be shared, there is information on how to become a member of Women in Global Health in Pakistan. Next slide. Next. Yes, so this is a topic that I am very passionate about, which is women leaders in global health. So Women in Global Health, the previous initiative, is around grassroots organizing of women. This is around leadership development, where we know from the evidence that women leaders, and I showed you the COVID example, right? The women leaders can be more transformative, and having gender-based balanced leadership teams leads to better performance. So the hypothesis here is that investing in leadership development for mid-career women and creating networks of connected women practicing collaborative leadership will generate higher impact in global health. And on the left, you see the base of global health female work participation, and you see how many women are in the leadership role. Because for women to get to a leadership journey is not a straight path. It's a labyrinth in which they need to figure out, because there aren't role models, there isn't support, and there are a lot of barriers that they encounter. So how do we help women who are already have gone through a lot to get to the mid-career, to get to senior levels, with the idea being that once you have enough women in senior level roles, that you will really have transformative impact on improving health outcomes for all, because they will be drivers of change. So where this program is now called Women Lift Health. And we are just in this launch phase. This is a global program also. And many actually Pakistani women have been sponsored to come to meetings. This year, the meeting was virtual. One meeting was a really fantastic physical meeting. The last physical meeting was organized by the opening speaker today, Dr. Agnes Venengaho, and was a very successful meeting in Rwanda with more than 1,000 people, women and some men from around the world, male allies, attending that. When we go into the eventual plan would be to go into phase 3, which is the regional expansion plan, where we would be adding 1 to 2 regional hubs annually, and eventually aiming to train and sponsor about 5,000 women over a 10-year time horizon. So it's a long-term plan, but something that I think will really be transformative. Next. So let me end here by summarizing my basic thesis, that is, when we address gender inequality and remove the underlying barriers for women and girls, we unlock the potential for all people, men, women, boys, and girls, to be equally valued and to lead healthy and productive lives. And this can save the world. Equal is greater. Thank you.
Thank you very much, Anita, for that inspiring presentation. Without further ado, I'd like to move to our second keynote speaker for today, Dr. Sania Nishta, who I've already introduced. And Dr. Nishta is going to talk to us about the ISA's emergency cash program that she leads and its real-time evaluation. Sania, the floor is yours.
Thank you very much, Zulfikar, and good day to all of you. I'm just struggling to get my slides up and running, so if I can have some help from your end, that would be great.
Shamsa, do you have Dr. Nishta's slides, or can you help her share her screen? Sania, there should be an icon at the bottom.
Dr. Sania, can you share me your final slides?
No,
Yes,
she's got it now. Yeah, yep.
Okay,
got it.
great.
So just put it on full screen if you can at the top.
Yeah.
The slideshow right at the top.
One of the disadvantages of connecting from home, you don't have support.
All
So
the
just
technology.
bear with me for a minute.
To the top of the screen, you can see. Yeah, got it. Great.
Okay, great. Thank you. So first of all, I want to congratulate you, Zulfikar, for convening this important event and for getting us all together in the room, and for the emphasis on gender, which is so hugely important. I wanted to be very practical today, because we all know how crucial gender equality is for social and economic outcomes, and more broadly for creating a just and fair world. Many of us who come from academic backgrounds, from advocacy backgrounds, have actually spent a lifetime advocating for that. And for me, the challenge was, here I am in a decision-making role in the government, sitting in the cabinet. How can I actually how can I actually ensure that all that I've advocated for throughout my life, how can I practically demonstrate that it's possible to change words into action? So with this as a context and as a perspective, I thought I should be very practical today and explain to you how I have tried to embed the gender perspective in the SARS program, which I'm going to describe in a moment. How I have tried, with a lot of help, to underscore the salience of this particular policy aspect. And I'm just going to be very practical as I take you through a couple of slides. Whilst I do that, I will also focus on one of the experience we've recently had with real-time evaluation of a very large program, because I know that this seminar that you have today is heavily focused on the research aspects, and I couldn't help building in a bit of that into my presentations. So let me start off by telling you that about 2 years ago, less than 2 years ago, I was asked to join the government of Pakistan, and I was asked by the Prime Minister to put together a large poverty alleviation program. He told me this was a priority for him. And after three months of deep dive into consultations at lightning speed, morning, noon, and evening, I came up with the framework, which was called ASAS. ASAS in Urdu means compassion. And ASAS is essentially a multisectoral, a multifaceted, a multi-component, integrated social protection and poverty alleviation program. And right from its inception, I was very clear that 50% plus benefits have to be for women. That is how the program is structured. That is how it is being implemented, and it's being very rigorously monitored for delivery around the 50% plus principle for women. Before I tell you a little bit about the gender-specific aspects of ASAS, I want to give you an overview of what ASAS is. So basically, ASAS has 144 elements. Those elements, some of those elements are large programs that cost over $1 billion a year. And some of them are small policy actions that can be taken at the individual ministry level. All of them are pro-poor. All of them are focused on poverty alleviation and social protection. There are different ways of classifying the 144 actions and elements within ASAS, within the ASAS framework. You can either classify them based on the executing responsibility, and you will see 3 colors emerge again and again on some of the slides that I will show you. The green ones are the social protection elements within the framework. Those are my execution responsibilities. They fall within the execution mandate of the Poverty Alleviation Ministry. Then there are the pink dots, which illustrate the poverty alleviating actions that are the responsibility of 34 federal ministries. And my role is to the extent of monitoring them. And then there are actions that are that emerge as blue dots. Those are the responsibilities of provincial departments, various provincial departments. And again, my responsibility as the steward of ASAS extends to the remit of monitoring progress and to bringing the progress in front of the steering committee, which is chaired by the Prime Minister, of which I am the vice chair. So this is one way of classifying ASAS in terms of the executing responsibility. There is another way of classifying the various 144 actions within ASAS, which is, and the classification is centered on the individual or the group of individuals that the actions benefit. And here on the screen, you can see 14 target groups: poor elderly citizens, poor women, non-affording students, the undernourished, poor farmers, the differently abled, the jobless, homeless, widows, orphans, the extreme poor, laborers, those at risk of medical impoverishment. And then there are actions centered on making the government pro-poor. So there are 14 target groups, and you can align the different initiatives within SRs according to those. And here you will see that the different colors align differently because different executing agencies are responsible for tasks and actions and programs with different endpoints. There is yet another way of classifying the actions within SRs, which is by virtue of the technical pillars under which they fall. So there are safety net interventions that align below the safety net pillar, another set of interventions that are primarily human development centered. There's a job and livelihoods pillar and a pillar focused on pro-poor governance. And as you can imagine, there's a lot of overlap between these pillars. Now, these actions and policies and programs, which number 144, are not a disparate set of actions. They are all linked through theory of change, and each mutually reinforces the other. They're all mutually reinforcing. And the SR strategy actually outlines the rationale behind these and how they've been structured and how they are structured to fall within a theory of change model. The SR's strategy is publicly available, and this was the first time a government document was actually sent for consultation to the public and to government ministries at the same time. And the feedback that we got really helped to modify this strategy and to make it more robust. Now, we have 7 time-bound outcome-based goals within the SR's framework. So essentially, it's financial access to healthcare for 10 million families, scholarship and incentives for more than 5 million students, safety nets for 10 million families, livelihood opportunities for 3.8 million families, financial and digital inclusion for 7 million individuals. These were the time-bound outcome-based goals that we had pre-COVID, because the strategy was finalized in mid of 2019. But post-COVID, there will be another round of consultation because we've currently done new estimates on poverty, and we will now go back to the drawing board to revise these numbers and then to take to the cabinet and ask for augmenting both the budget and to approve the post-COVID revised time-bound outcome-based goals. Again, around these goals are a set of policies and programs which are aligned in different pillars, and they contribute to these time-bound outcome-based goals. And then there are a number of different initiatives which are cross-cutting. Now, to execute this huge program, we spent a year building the institutional architecture. So a new ministry was created because previously there was no ministry at the federal level. And there were 7 ministries under which different departments involved in social protection, poverty alleviation fell. So we created a new ministry. The largest budget for social protection ever in the history of the country was carved up. Technical communities were constituted. The partnership forums were created. The cabinet approved the SR's governance and integrity policy. We established a governance observatory to track progress. A deep-rooted reform plan was developed for the largest executing agency, which is BISP, and a whole host of other actions were taken, including setting up the digital infrastructure for executing some of the programs. So we procured a digital payment system, brought 2 commercial banks on board. We developed the data analytics mechanism. We developed a demand side social protection infrastructure, and these three pieces of the digital backbone then came into play when we executed COVID-19 related emergency cash. My apologies, there's a slide missing in which all these things are outlined, which is why I just stopped on this slide. So So in addition to the various programmatic strands, and I'm going to give you a flavor of some of the programmatic strands, there was extensive work done to build the institutional pillars. And as you can imagine, it has been a very hectic year and a half for me and my colleagues, because we were building the institutional infrastructure, we were structuring the programs, we were rolling them out. And when you roll out government programs, there's a huge amount of work that has to be done. When you work in the government, you also have to tackle all the attacks from the opposition, from hostile media. And so it has been a very, very tough 1 year. So I wanted to give you a sense of what SARS is, how extensive it is, and how further along we've come in setting up the program. There's still a lot of work to do. So I'm going to slightly switch gears and now focus on the gender perspective. Now, in terms of the gender perspective, as you know, and I don't mean to read out everything on the slide, if you look at the left side, there are a set of norms starting from the constitution to frameworks that the government of Pakistan has signed, to acts of parliament, to various policy frameworks, which actually are very rights focused when it comes to the rights of women, when it comes to their participation, when it comes to gender equality. But the right side of my slide is actually what stares out at us. And Anita also presented some of these figures in her presentation. Female labor force participation, 24%. Education outcomes, abysmal. Health outcomes, which many of us have spent a lifetime struggling to improve, very poor. 70% of women not allowed to leave the home to go to a bank or attend a meeting or to go to a job. 59% of the poorest of the women in the poorest wealth quintile actually do not have a say in their healthcare. So despite progress, despite the fact that at the higher education level, there are more women in university than there are men, despite the fact that in terms of representation of women in parliament, we are not doing very bad. When it comes to social outcomes, numbers don't look good. And that is the context that we're looking at. So when we were structuring different SARS programs, the 50% plus rule was very important for me, and I squarely embedded it in most of the large programs that we were running. For instance, SARS Kafalat is 100% women. We have, in previous years, less than 5 million households were being helped. Less than 5 million women were being helped. We've taken, pre-COVID, we took it to 7 million. And I'm going to make a case for us to go to 10 million. Allied to this is the SARS One Woman, One Account initiative, where we have invested heavily in building the digital and financial inclusion infrastructure to financially include 7 million women in the next 3 months, and to give the background work to develop the infrastructure to enable their access to savings accounts alongside their limited mandate accounts in which the government puts money is all complete. And in fact, on Friday, day after tomorrow, the Prime Minister is going to be launching this. Then in our National Poverty Graduation Initiative with its 3 components, which includes asset transfers, interest-free loans, and vocational and skills trainings, 50% for women. Its component, cash for work, is 50% for women, which has a budget of 42 billion with an impact envisaged for 13.8 million individuals, currently rolled out in 150 districts, and its progress is on track since last year. We monitor this very, very aggressively. And in the past couple of months, the participation of women has ranged between 45 to to 45 to 49%. The disbursement to this program is linked to achievement of 50% loans for women, and it's being very aggressively monitored. An allied program is a program which enables access of small assets to facilitate small businesses for very poor families. Its impact is envisaged for 1 million individuals. It's currently ongoing in 23 districts with the lowest MPI. And in this program, it's squarely focused 60% for women. Then in terms of SAS undergraduate scholarships, which presents, so basically over the last 10 years, the government of Pakistan set up the Higher Education Commission and committed, it really raised the ceiling of resource allocations for the Higher Education Commission. But the investment was largely for at the postgrad level. We've broadened this to have a much higher focus on at the undergraduate level. So over 4 years, the commitment is to give 200,000 scholarships. And over the last 1 year, its progress has been on track. 50% of the scholarships are for women from very disadvantaged backgrounds, not only in terms of their socioeconomic conditions, but also from very disadvantaged districts. Then there is SAS Nasho-Nama, the Health and Nutrition Conditional Cash Transfer Program. We have an expert committee on which both Zulfikar and Anita sit. We took quite some time to design this health and nutrition conditional cash transfer program. So immediately after I took office, I constituted this expert committee. We had a series of meetings. We looked at evidence and best practice, and then we we reached the conclusion that it was both feasible, it was needed, and perfectly justified for us to have a health and nutrition conditional cash transfer program with specialized nutrition food as one of its components, and with cash transfers as one of its components. By government standards, we have deployed this, I would dare I say, at lightning speed. So currently the program is up and running in 9 most disadvantaged districts where 35 centers have been established. The board has recently given me approval to upscale it to 12 districts. A process evaluation is underway. An impact evaluation will soon be commissioned. We envisage that the operations in 12 districts of the country will impact 1 million individuals. And we are all set for a nationwide scale up. The Prime Minister has already announced it. The outcome of interest is to impact stunting, which, as you all know, has a very high prevalence in the country. Overall, there's a 42% prevalence. The trend lines have looked horrifically linear ever since Pakistan's inception. And in some of the districts where we are operating more than, in some of them prevalence is as high as 56%, 58%. What I'm really proud of is that we were able to develop a new stipend policy for our conditional cash transfers, both health and education. And in this particular program, the stipend per quarter for girls is much higher. It's 2,000 for girls. And I beg your pardon, there is a typo. This is not 15,000, it's 1,500 for boys. There is also a related conditional cash transfer program, which had been running for the last 8 years. It was operational in 50 districts when I took over. It was all paper-based, and the stipend amount was very low. So our contribution has been that we have reformed it entirely. We've made it end-to-end digital. It is a paperless program. The stipend has been increased in line with the SR stipend policy. And we spent 1.5 years building the infrastructure to take it nationwide. And I'm very pleased to tell you that Wasila Talim Digital under the SR's banner is now running in every district of the country. Still a lot of challenges. the most salient of which is centers on the need to upscale it to the secondary level, because there's a lot of attrition. A lot of girls fall through the cracks after they complete primary education. So we are introducing a graduation stipend at the intersection of primary and secondary. And hopefully before I leave this job, I would have taken this to scale at the secondary level as well. In addition to our cash transfer programs, in addition to the access to education programs, there is the Essas food soup kitchens, which we've rolled out in partnership with an NGO with zero cost to the government. Very powerful when you see it on ground. There is the Panaga program, which with the Prime Minister is particularly keen on, and he's rolling it out nationwide. Under the Panaga program, laborers who otherwise slept on pavements are now provided with one-star bed and breakfast facility all over the country. I forgot to put another slide which had to do with the preparations underway and the planned rollout of a new shock-oriented safety net, which is called Essas Tahaffuz, which is scheduled for a soft launch in December this year, hopefully on World Universal Coverage Day, which is December the 12th, because the shock-oriented safety net will initially be rolled out to prevent against catastrophic health expenditures. I wanted to give you a sense of the National Socioeconomic Survey, because underpinning these entire operations is the National Socioeconomic Survey, which is fast reaching completion. This is Pakistan's first digital census, end-to-end digital census conducted with electronic tabs at the household doorstep, and this is 55% complete and envisaged to reach completion by May next year. Those households that are left out, and you can see an illustration of that on the screen right in front of you, have the opportunity to come to the Essas registration desks, and subsequent to their complaint and they're raising the hand that they've been missed out, we send field teams to register them as well. We are fast moving to a one window Essas ecosystem, which will comprise of three things: an app which consolidates all our programs, a physical center we call the Essas Center, where people will be able to go to access all our services, where we will have ATMs for people to draw money, where we will also have the complaint management and resolutions mechanism in place. And the third part of Essas One Window is the data sharing mechanism on which work has been ongoing for the last 3 months. So if I have 5 more minutes, I would spend a couple of minutes on Essas Emergency Cash and talk a little bit about real-time evaluation, because I'm an old-fashioned researcher, perhaps not as distinguished as many of you, but we are focused on impact evaluations and case control studies and process evaluations. But the power of real-time evaluation, common sense real-time evaluation that I saw and that I experienced and that I actually used to refine operations was something that I wanted to share with this learned audience. The context is another of the Essas programs called Essas Emergency Cash, relevant to the theme of today's seminar. 45% of the benefits, 45% of the recipients of Essas Emergency Cash were women. And to outline the context, we're talking about 15 million families, over 100 million individuals impacted in this 5th most populous country in the world at a time of extreme uncertainty when COVID struck, and when we were given the mandate to put cash into their hands. Because as you know, 2/3 of Pakistan subsists on either daily wages or on piece rate remuneration, or their breadwinners are employed in Pakistan's very large informal economy. And for 2/3 of the country, life came to a standstill with the lockdown. So we were given the mandate to put cash into their hands. And I'm very humbled and honored and deeply humbled that we were able to do this with integrity. 49% of the recipients were women. When we started Emergency Cash, we did a scan, and the international experience was telling us very squarely that cash is much better than vouchers, and that vouchers are much better than in-kind, which really bolstered our confidence. As I already mentioned, we leveraged our new biometric payment system, the demand-side SMS request seeking mechanism, and the new wealth profiling data analytics mechanism. And these were all capabilities, infrastructure building capabilities that we had invested in 2019. And we actually pulled a dot, kind of threaded through these three things and structured a SARS Emergency Cash. And I told my colleagues, we have no option. We have to cross the river as we feel the storms. We have to be prepared for failure, but this is the time when half the country is looking at us. And there were a couple of things that really helped us deploy this. Number one, it was totally rule-based, end-to-end digital. The SMSs would come, they would dive into different databases. Messages of acceptance and regrets would go out in a rule-based manner. The second thing that we did was that we were totally transparent right down to the tehsil level. Where was the money going? Who was it going to? How many accounts were being credited? How many accounts were being debited? Because it was actually cash that people were taking, not many people realized that this was actually built on the core banking system. And these were bank accounts that we were crediting and that people were drawing money out of. So there was a dashboard where everything was mentioned. The other feature which really helped was its apolitical nature. Because as you can see from the stagger bar chart on your extreme left, Sindh was the biggest recipient of SARS Emergency Cash, despite there being an opposition to the party which forms the government in the central government at the federal level, of which I'm a part. But because this was a totally apolitical operation, we were able to garner support across the board. And this is perhaps my last slide on which I'd like to spend a few minutes. What did real-time evaluation mean? The real-time evaluation meant listening to people and voices on the ground and coming back and making and rectifying. Because you have to imagine that here you were at a time of extreme uncertainty when the entire country was shut and you were working out of this one office in Pakistan Secretariat, trying to get cash into the hands of more than half the country with a handful of people because the others were sick. And you had no option but to go ahead. And the lever in your hand was information and your commitment to listen to people on the ground and to make modifications as you went along. And I recall my colleagues and I was sitting in office all day. And what was it that we call real-time evaluation? So I recall the first week when I went into the field and there were a group of laborers and we had been heavily advertising SMS us on 8171, SMS us your ID card number. And I remember going into the field and speaking to a group of laborers because remember, the intercity transport was shut, inter-district transport was shut, people could not go. So these laborers who worked in Karachi, Lahore, Islamabad, in big cities were actually out of work and they were sitting on wherever they used to sit. And I asked them, I said, have you SMS'd us? And half of them raised their hand and half of them said, no, we don't know how to SMS. So then we mobilized volunteers. Then there were a few of them who said, we don't have credit. So we cannot SMS you because we don't have credit. And then we had to go and make the SMS service free. Then there were limitations of data-driven messaging because notifications were going to dead beneficiaries if they were the head of the household. So we had to explain, we had to tailor our communications accordingly. Then we figured out that, that payments were not happening with expired CNICs. So we had to make sure that the NADRA did the back-end configuration to allow. Then we figured out that some of the retail agents who were making the payments on ground were very reluctant to operate in that very difficult environment because Section 144 was in effect. And they said, you have to waive off the tax that you deduct on our commissions. So we scrambled, spoke to the Cabinet Committee on Economic Coordination, which turned down our proposal. And then I had to convince the Prime Minister that this waiver on tax, IMF or no IMF, is required for emergency in the COVID situation. Otherwise, the retailers are not going to work with us. So there was a waiver brokered. Then I had to go to all the provincial governments to ask for similar waivers. Then when we were rolling out on a day-to-day basis, there were issues with liquidity, with connectivity. There were logistic issues on ground. We experienced biometric failure for 7% of our patients, for which, because we were validating the beneficiaries who received our authorization SMS in real time. So there was a 4 to 7% biometric failure for which a workaround had to be developed. We were constantly under cyber attacks because, you know, whenever the money moves, there are cyber attacks. We had to deal with it. We had to deal with it through a variety of different means. There was disciplinary action that had to be taken at the field level. Then there were slower withdrawals in certain categories for which a workaround had to be developed. So I cannot go into all the details. We've done a very detailed report on this, which I'm very happy to share with you. But the point I'm trying to make in this convening of stellar research experts is that as a researcher, we have a frame of thinking, and I had a similar frame of thinking. But to me, my sense of what research is or should be, in addition to what we think research is, has really changed since I've started doing things operationally on ground. And I think that in a real operational context, the agility with which you do real-time evaluation, the agility with which and your commitment to learn from that and to plow that into your operations is what really makes a difference. And I thought that this might be a good way of ending the presentation. So to summarize, we have a deep commitment to serving the poor. We have a deep commitment to ensuring that at least half the benefits of that go to to women. And in some of our programs, you've seen that some of our very large programs have a heavy bias towards women and girls. And this is just not in stated policy documents. This is actually in flesh and blood and is seen on ground. And I think that you cannot serve people unless you have a commitment to learn from what you see on ground and to continue to refine your operations as you go along. So these were just a couple of reflections from my recent work. I really want to thank you, Zulfikar, for giving me this opportunity, and I also want to thank you for being such a great partner and
thank you, Sonia. Thank you. That's a fantastic presentation. I know we have tons of questions, and I'd like to at least get an opportunity for a few. But before that, let me pass the floor to Gulnora Mohammadieva, who is our global gender equality lead at the Aga Khan Foundation, and she provides strategic direction to the civic society portfolio at AKF. She has over a decade and a half experience of working actually on the ground in international development with a number of UN agencies and bilateral partners. So Gulnora, we would love to have you give us some overarching comments, and then we'll open the floor for a few questions that I will pose to both of our wonderful keynote speakers. Over to you.
Great, thank you so much.
You're muted, Gulnora. Please.
Can you hear me now?
Yeah, yes, we can. Thank you.
Yes, thank you. Thank you so much, Dr. Bhutta, for this opportunity to join the webinar. And I would really thank Dr. Anita and Dr. Sanya for very inspiring and interesting presentations. And I would like to spend a couple of minutes sharing some of the reflections and also speaking about the Women Leadership Academies that we are designing together with Aga Khan University. So I think we all agree that currently we live in entirely unprecedented times, and unfortunately COVID has further complicated what were already very complicated development challenges, especially in South Asia and Central Asia. And it is clear that ensuring that women are included in decision-making and increasingly taking role on the leadership position must be a top priority. So in these two presentations, we saw how it's crucial, you know, on the Dr. Anita's presentation, the examples from different countries where they had the female leaders and to what extent their approach to managing COVID pandemic was completely different, which also helped in this crisis situation. And I think we all agree that it's simple common sense that excluding half of the world's population from the search for the solution that this world so desperately needs will inevitably lead to suboptimal results. And again, in the second presentation, Dr. Sanya showed the importance of focusing on women and the vulnerable women and helping with the cash transfer and all the social protection projects. And Dr. Anita asked if gender equality can save the world. I think this is an open question, but what is certain is that without gender equality, we are all lost. And I hope you all agree that without ensuring that there is gender equality, we cannot leave a safe, just, and less discriminatory world to our children. And in Aga Khan Foundation, of course, gender equality is central to anything we do. And our global program framework is focused in 6 thematic areas. So we are working on health and nutrition, on economic inclusion, on education, early childhood development, agriculture, food security, and civil society. And we are looking at gender equality from the different ways in order to promote women's empowerment through our programs. And we also have a programmatic approach in terms of integrating gender and as well as looking into our internal operations and practices. And of course, COVID pandemic put lots of pressure and lots of complications to how we implement projects on the ground and how we are engaging with our communities. But despite this fact, we will continue and we will intensify our efforts to put women and girls in the leadership position at the community level. And we will equip them with skills, knowledge, and support to take these leadership roles in future. And just now we had very inspiring examples from Pakistan, from Dr. Sanya Nishtar's presentation, that we have to start from the basics. So making sure that women can start making the most basic decisions, such as decisions related to their own health, decisions related to their health-seeking behavior, to education, to access to having a bank account. So we need to include women financially and digitally and put cash in their hands so that it will help them to take control over their livelihood, so that it will empower them economically. So we all agree that girls need to be educated, and education plays a key role in girls' life and in your future well-being. And also it's very important if we have educated girls to what extent she will have strong skills and leadership skills in future. So I can bring many examples from what Aga Khan Foundation, of course, does in all the geographies where we work. And we do have projects based on the kind of self-help groups where all the young women and adolescent girls can come together and have a safe space to talk about their issues and then have some joint economic activities. So I'm sure many of you are aware of these self-help groups which exist in India, in Pakistan, in Afghanistan, in Tajikistan. And through our community-based structures, we are also working closely to raise some of the sensitive issues when it comes to gender equality, access of girls to education, then early marriages, all the risks associated with early pregnancies and early marriages. And of course, it's important that gender is built into anything that we do in the development sector. It's the COVID also showed to what extent we simply cannot ignore this issue anymore. And at Aga Khan Foundation internally, we are also putting more emphasis, increasing the representation of female staff in the middle and senior levels, and so that we have a strong talent pipeline. Briefly about the Women Leadership Academies that Diana mentioned at the beginning of this webinar. It's a new partnership. We are hoping to work more closely with Aga Khan University and develop a course on women leadership, because when the design for this new partnership happened, we realized that there are many leadership courses in the West where like there is a good access and the talented female can go. But unfortunately in Asia, in South Asia, we don't have so much. So therefore, instead of investing into sending participants abroad or like sending them to some short-term courses, we decided to design something in-house. And of course, Aga Khan University is a natural partner, so that we have a more kind of structured and sustainable program for all the future leaders in our region. And the discussions just started in terms of the content and the first cohort, but hopefully we will be able to launch this early next year. Unfortunately, with COVID also, there has been some delays in terms of the design of this initiative, but I'm really excited about this, and I'm sure we'll have a very good partnership, because we all agree that there is a need to strengthen the education opportunities, the leadership courses that is required in this part of the world. This is all from my side, Dr. Bhutta. Thank you so much.
Thank you very much, Gulnora, and particularly the Institute will be very, very happy to support any of your activities, and particularly the learning agenda. Now, I have a ton of questions and limited time. So what I'm going to do is I'm going to pass a couple of questions to you, Anita. Then I have a couple for Sonia. And then finally, I'd like to pose one question to both of you that I'd like you to answer. It's actually been posed by one of the participants. So let me start first, Anita. There are a bunch of questions related to the relationship of gender issues and climate change, both from a planetary health perspective and also from the point of view of what we face in the context of global challenges, such as the recent outbreak. Could you elaborate a little bit more on this as to how are women central and important to this issue?
People don't realize how central women are to agriculture and so it's the same. You pick up any sector and you find the same thing. The frontline workers, the hard manual labor, it's all women. But the decision making is done by like who owns the crop and who sells the crop. That's men. And so the biggest impact on climate change is going to be on agriculture and on livelihoods. And if we do not include the women in those conversations and how to make resistant and resilient crops to climate change, and how to farm in a very climate adverse environment, we will be very short of food in the world, to be blunt about this. So, so including the impact on women's lives from climate change in agriculture would be the primary consideration. There are many other ways in which climate change, with the rising, I mean, once things are really gone overboard with rising seawater and loss of coastal habitat, all of that, that's a later thing. The earlier issues are around displacement and migration to urban areas because croplands are drying up, as well as on agricultural workers. And so women are central to both. Also, when climate change will result in conflict. And when conflict happens, women suffer much more than men do because services to women are the most fragile. They're the first things to go. COVID has shown that as well. And so it's all connected up. It's all, I mean, I like the word planetary health for this way because you can't really pick out one thing and say that it's a unidimensional issue. This is all multiple dimensions.
Thank you. And since Sania served on the Planetary Health Commission, Sania, do you have anything to add to that?
I think it's very context specific. I completely agree with Anita, but in some settings it's really accentuated. And in Pakistan, for instance, when unexpected flash floods happen, you see how communities are displaced and what it does to poverty, and it is always women who bear the brunt of the problem. I mean, flash floods, droughts, unexplained situations. Unexpected climate events are one of the most devastating, catastrophic events for poor communities. And it's who are the least resilient. So I completely, so for us, from a poverty perspective, from a catastrophic situations, it's perspective, from a poverty perpetuating events perspective, climate change is really poses a huge burden.
So we're over time, but I'll take a couple of minutes. So Sania, there is a question on the sustainability of the ESAS initiative. I mean, what is there in the pipeline that would ensure that this is not just a one government phenomena?
Well, I think before sustainability, the question of ESAS and the question of it surviving the tenure of the current government is very important. And to that extent, we have ensured cross-party acceptance of ESAS by demonstrating that it is truly apolitical. And the most salient illustration of that you saw in ESAS emergency cash. I showed you one slide which demonstrated that Sindh benefited the most. And in fact, this is perhaps one of the few programs where there has been cross-provincial participation. Initially, there was a lot of skepticism for a number of different reasons. That here is 200 billion being pushed into a pipe without any precedent. This is a completely new model. As you know, politicians are very used to the budget being carved up between M&As when catastrophe happens, whenever there are flash floods and natural disasters or earthquakes or any disaster of that kind, they are used to a certain modality of working. Cash is carved up between M&As and MPAs with very little accountability of how it is, with no targeting. It basically goes to their constituencies with little accountability. So you can imagine the pushback I had initially.
Oh, of course.
When I presented this.
And you weathered it very well. So my final question to both of you, in the reverse order, but start with you, Sania, is that you're both amazing women who have achieved phenomenal success in a very misogynistic environment. I mean, Pakistan is a country with whatever you take as an indicator, the gender inequality index or others, not on anybody's top tourist list. So how did you navigate that space?
Well, I think for me, do the right thing. I mean, never be swayed. And I think that has been, especially in my, whether you like to call it a political career, that has been the most cardinal pillar. Do the right thing. And then, of course, you have to put in 10 times the amount of work that men do. Sorry to be saying that, Zulfikar. But, so work hard, believe in yourself, have clear goals, do the right thing, don't be swayed. I remember when I came into public office first, I would just not stop saying no to people who were asking for favors, 100% of which were unwarranted. And people told me, you are not going to survive like this. You are just not going to survive. When I was conceptualizing a SARS cash, people said, this is political suicide. You just have to play along and let them do what they're used to doing. And I said, no, that is business as usual, is not what I'm here for. If I fail, this is something worth failing in the process of trying to do that. So just do the right thing, work hard, believe in yourself. And there are enablers along the way as well.
Including a supporting spouse. I mean, to give my regards to Ghalib, it always helps to have a partner who believes in you as well.
Absolutely.
Anita.
And a supportive mother-in-law as well.
Absolutely.
I agree.
Your views on this?
Yes, so I agree with what Sania said. You have to be brave and courageous, and you have to believe in yourself. You have to have big dreams, and you have to persevere and not let anybody get you down. You have to keep going, keep picking yourself up. People will pull you down, but keep going, and soon people will start seeing that you can actually make a difference, that you can, and you will start believing it yourself, that you can actually make a difference, you can change things, you can make things better. And that is a very powerful feeling when you can see that the work that you've done is yielding results, and it keeps reinforcing itself then. So that if you're lucky enough to find a role model, a mentor, that helps. It's especially for the dark times. There will be dark times, there will be low times, there will be when you feel unsure and doubtful, and being able to reach out and get help at that time can sometimes be save you from making the wrong decisions or choices.
Fantastic. And that is such a happy note to conclude our webinar. Particularly, I would like to point out that we have had over 200, close to 250 participants. There's still 200 people almost online, and a majority of them are actually young women, students, young faculty members, professionals from all over the country and the region. And I hope that they have seen in both of you today, and also in our discussant Gulnora, role models of people who have walked the talk and who have shown how once you put your mind to something, you can achieve the apex of success, and not only succeed yourselves, but lead other people on the path to success. So fantastic, and thank you so much for being leaders, women leaders in science and global health, and more power to your elbows. So ladies and gentlemen, remains for me to thank not only our speakers, but our participants and the university for creating the platform from which we are speaking to you today. This was the third in our series of webinars from the Institute for Global Health and Development, and it really is beginning to tackle the so-called wicked issues, the difficult things that we need to tackle overall. Our future webinars will be focused on issues of sustainable development goals and where are we 5 years into them and just the last decade. And also, very importantly, the response to COVID-19 and the big challenges that the world faces around equitable access, response, and ensuring that we are better prepared for the next pandemic. So watch the space for timings for those two webinars. And thank you very much for your attendance. So thank you again, Sania, Anita, and Gulnora. Goodbye and have a good day.
Thank you, Dr. Bhutta. Thank you to all of the people who helped organize. I know Diana and Shamsa worked hard. Thank you.
Thank you.
Thank you.